Hello, and welcome back to AI Academy, your go-to channel for all things artificial intelligence. Today, we'll be discussing a breakthrough in the field of cancer research, specifically colorectal cancer. Researchers at the University of California, San Diego have developed a new AI tool that accurately predicts the aggressiveness of this type of cancer. This is great news for patients and doctors alike, as it can lead to more personalized and effective treatment plans. So let's dive into the details. First, let's start with some background information on colorectal cancer. It is a cancer that begins in the colon or rectum and is the third most commonly diagnosed cancer in both men and women. It is also the second leading cause of cancer-related deaths in the United States. Treatment options for colorectal cancer depend on several factors, including the stage and aggressiveness of the cancer. This is where the new AI tool comes in. The tool is based on a machine learning algorithm that analyzes images of colorectal cancer tissue samples. When a patient undergoes a biopsy, a small sample of tissue is removed and examined under a microscope by a pathologist. Traditionally, the pathologist visually examines the tissue samples and determines the stage and aggressiveness of the cancer based on several criteria, such as the size and shape of the cancer cells. However, this process is subjective and can be prone to error. That's where the AI tool comes in. The researchers trained the algorithm on a data set of over 900 tissue samples from patients with colorectal cancer. Each sample was labeled with its corresponding stage and level of aggressiveness. The algorithm uses a technique called deep learning, which involves training a neural network to recognize patterns in the data. In this case, the neural network learns to recognize patterns in the images of the tissue samples that are associated with different stages and levels of aggressiveness of the cancer. Specifically, the algorithm examines several features of the cancer cells, such as their shape, size, and texture. For example, aggressive cancer cells tend to be irregularly shaped, with larger nuclei and more variation in cell size. The algorithm also examines the way the cells are arranged, as tumors that are more invasive tend to have cells that are arranged in a disorganized fashion. After analyzing the images, the algorithm produces a prediction of the stage and aggressiveness of the cancer. In tests, the algorithm was able to accurately predict the level of aggressiveness of the cancer in 95% of cases, which is a significant improvement over traditional methods. It's important to note that the AI tool is not meant to replace pathologists, but rather to supplement their analysis. The tool can provide an objective evaluation of the tissue samples, which can help pathologists make more accurate diagnoses and treatment recommendations. So what does this mean for patients and doctors? Well, for starters, it can lead to more personalized treatment plans. If the AI tool predicts that a patient's cancer is highly aggressive, doctors may choose to pursue more aggressive treatment options, such as chemotherapy or surgery. On the other hand, if the tool predicts that the cancer is less aggressive, doctors may opt for less invasive treatments or a watchful waiting approach. This can help minimize unnecessary treatments and their associated side effects. Of course, like any tool, there are limitations to the AI algorithm developed by the researchers. For example, it was trained using tissue samples from a single medical center, so it may not generalize well to other populations. Additionally, it is still unclear how the tool will perform in real-world clinical settings. However, these limitations can be addressed with further research and development. Overall, the new AI tool developed by researchers at the University of California, San Diego, is a promising development in the field of cancer research. It has the potential to improve the accuracy of colorectal cancer diagnoses and lead to more personalized treatment plans. As always, we at AI Academy will continue to keep you updated on the latest advancements in artificial intelligence. Thanks for tuning in.